Hello everyone, my name is Nandita Rajamani and I am a PhD student working with Dr. Andy Horn at the Network Stimulation Laboratory in Berlin. I'm happy to introduce you to our project, which is on symptom-specific connectomics in deep brain stimulation surgery. The main objective of our project is to look at diseases as a constellation of symptoms rather than as a singular disease in itself. We look at 129 patients who have been diagnosed with Parkinson's disease and have undergone deep brain stimulation surgery at the level of their subthalamic nucleus. In the first step, we build a symptom library. For this, we extrapolate on a previously established method called discriminative fiber tractography. So we establish tracts representative of 4 symptoms in Parkinson's disease: bradykinesia, rigidity, axial or gait, as well as tremor symptoms, by correlating fiber tracts with improvement in each of these symptoms across the entire cohort of the patients. We correct these tracts for significance using FDR correction, setting an alpha value of less than 0.5. In the second step, we bias this model by using the normalized baseline scores of the cohort. Finally, we train the model for prediction of global improvement in Parkinson's disease, that is the UPDRS-3 improvement, by using a weighted average of these 4 subscore values. So with this, we are now able to see a really neat topographical organization of the tracts across the STN. So tracts representative of tremor project to the M1 region of the cortex, whereas the tracts responsible for rigidity, axial and bradykinesia project more to the SMA region of the cortex. We can also see that by using the symptom-specific model to predict the global percentage improvement, around 30% of the variance in the model can be predicted. So following literature validation of our tracts, we were interested in exploring further the tracts representative of improvement in posture or postural stability and freezing of gait. Particularly, we were interested in looking at the connectivity profile of freezing of gait. We see that the tracts representative of the gait components pass through the peduncleopontine nucleus and the cuneiform nucleus, both of which have been previously suggested as surgical targets for freezing of gait with deep brain stimulation surgery. So where do we go from here? We have a new patient who comes into the clinic and says, well, the most important symptom for me is tremor, and I want to take care of that. So using the symptom-specific model, we are now able to suggest DBS parameters that will engage tracts that are responsible for alleviation of tremor-specific symptoms. To wrap up, we can say that we first established symptom-specific tracts responsible for alleviating bradykinesia, rigidity, tremor, and axial symptoms. We trained this model to predict the global improvement in Parkinson's disease, and we saw that it can explain around 30% of the variance. We also realized that we can extrapolate models like this to understand more about the connectomic profile of diseases. Thank you very much for your attention, and please feel free to reach out at nandita.rajamani@charite.de if you have any questions. Thank you.